an examination of the rates of suicidal ideation in prostate cancer. So in other words, the amount of thinking that men do about the end of their life or ending their life because they're distressed. It came from our concern over the fact that we have an elevated amount of people out there, so a larger amount of people than we would like suffering from prostate cancer that have these thoughts of wanting to end their life. And when we compare that to the average person on the street without prostate cancer, that number's higher, and we consider that a risk. So what we're trying to do in this project is look at what might be some of the factors or some of the reasons why people who have the highest risk are in that position. We want to know what promotes bad places for our men suffering with prostate cancer. And what we mean by bad places is not just about the medicine, but about what the experience of having this disease and working through the medical process does to these men in regards to their psychology, in regards to their social supports, in regards to how they feel about their life. So, in other words, what are the types of things that they experience in their life? What are the types of things that they think? And who's around them? And how can that be important in trying to understand how we can help relieve that pressure that they might, is that when we have an understanding of what, the effects of a person's life are on the way they're thinking, we'll have sort of like a puzzle that goes in both directions. So if, let's say, for example, social support is low from people in your life or people in the hospital or just people in general that they're coworkers, and you don't feel that support is usable for you or it's not there, that can be what we call a factor that helps you feel less important in your life than you may have otherwise. So in other words, that kind of is a factor that can lead to you feeling more sad, more kind of apart from other people, and those types of feelings then can be associated with feeling like maybe my life's not worth living. Well, the study has started here in Kingston, Ontario, at Queen's University and with the KGH Hospital in the prostate cancer clinic. From there, we started to expand the project across Canada, and our latest sort of endeavor has been to expand it internationally. So we're really a growing data set, but the original data has all been collected on men suffering from prostate cancer in our catchment area. And what's interesting is the age of these men, because they're eligible from 18 years old, straight up to an unlimited ceiling for age. But the average age of the males in our study are about 68 years old. So we have a pretty representative sample of where you're going to see men with prostate cancer and the age ranges that would reflect that experience. I just want to say a personal thank you to the Prostate Cancer Fight Foundation and Ride for Dad for making this possible.